We're back here on Fox 51 today. Some major things happening at Trinity Mother Frances Hospital. We're joined by Mike Eckhard to talk about those. Mike, what a pleasure to have you here on our broadcast.
Thank you for having me.
Electronic medical records has been really the talk here ever since President Obama really started talking about implementing this new healthcare system. But this is something that I think hospitals may be trying to embrace because stepping into the 21st century, for years we saw a completely different system. This is going to change the way, and I think efficiency is probably the key here. So what is Trinity Mother Frances Hospital really doing with electronic medical keeping to change the way people's records will be kept?
What we're creating is one record for the patient. So when you see your physician in the doctor's office, the record is compiled. When you come into the hospital and you're cared for, that record's available in the hospital. The care that's provided in the hospital then goes into that same record, and when you follow up with your physician, it's again available right there for the physician to see.
And we're calling it ConnectCARE. So what exactly is this system, and how does it really change the interaction between, say, your doctor or even your interaction with the hospital itself?
ConnectCARE is what we have branded the product that we purchased. It's powered by Epic, which is a system that's used throughout the country. So this system is built to support the workflow and what we do to provide care here. So we bought a big product, we made it our own, and we've called it ConnectCARE.
What are some key features to the ConnectCARE system that we as patients can really keep in mind when we're going into the hospital?
Everything that is done is available in real time. So as soon as the tests are available and done, say lab tests are completed, they're available within the system. So even if the doctor's not here at the hospital, he can log on and see those results in a real time. They're available to everybody that needs access to them, so that patient care is provided in a timely manner.
What is the hope here of how this will improve healthcare overall as it's known?
It's geared for patient safety. So there are things built into the system. For instance, your list of all of the medications that you're on. If a physician wanted to prescribe a new medication, he can instantly tell what you're already on to make sure he isn't giving you something that's going to work against something, or perhaps you're already on it, and he can tell that at a glance.
Oh, cool. Well, when is ConnectCARE set to launch or go live so patients can begin using this system?
We're going to roll it out in the clinics on September 30th. And then we will roll it out in the hospital on December the 8th. Okay, well, this is something I know can change, and I know for some patients this will probably take a little bit more time, especially for those patients who are so used to the old record keeping. Is there a good source, or is there a place where they can go with questions or concerns that they may have in beginning to learn and use this new system, ConnectCARE? There's information on the hospital's website. Okay. There'll also be information through the offices to how the patients are going to be able to sign up, because they're going to be able to view bits and pieces of their records themselves.
Okay, transparency here, efficiency, some really good things with ConnectCARE. This should be very exciting, so look forward here in the next few weeks. Mike Eckhard, Mike, what a pleasure to have you here. Some great information. We really appreciate it. Coming up here next on Fox 51 today, Katie's got a look at our forecast. There's some rain in there, and there's some pretty darn good chances. Katie will tell us about it next.